And then the third one is that I see quite a bit is that people don't use the strategies that match or work with the state that their nervous system is in. And so I don't know if anyone else has tried this, but I have. Have you ever tried to meditate when you're really angry? No. How did it go?
So hello, everyone. My name is Day Cooper Hagel. I'm the director of Mental Health Wilderness First Aid, and we run mental health first aid programs for folks who work, live, or play out in remote areas. So it's kind of a unique combination of situations that we can face out in the field, or maybe you're in a fly-in community, or maybe you work in a tree planting community, whatever it is. And so how can we best help be aware of and support each other in a first aid capacity with mental health issues? So those are the kinds of courses that we run. And we've been very fortunate to host a number of guest speakers in the past year. And we've been really looking forward to Kennedy Lewis coming on as our guest speaker. Originally, Kennedy was slated to come on and speak for us in June, and that had to be bumped to September. So this has been long anticipated. And thanks for making the time for it, Kennedy. Really, really cool. So Kennedy and I went to school together when we did our master's degrees at the University of Victoria around 2018. We were in different cohorts, but we shared some classes. And that's been really great. He's also agreed to come on board and help facilitate some of the mental health wilderness first aid programs online, which has been awesome. We've learned and integrated a lot, especially into the trauma section of the mental health wilderness first aid course that has come from our having Kennedy on board and being able to help us conceptualize and facilitate some of those teachings. So it's been really awesome to have Kennedy as part of the team. And Kennedy, I'm just going to read the bio you sent me, if that's
Go for it.
Good for you.
That's what it's there for.
Great. So Kennedy Lewis is a trauma therapist with a master's in counseling from the University of Victoria, currently practicing in Vancouver, British Columbia. Alongside her private practice, Kennedy founded and developed Extraordinary Workers to help support workers on the front lines cope with the trauma exposed environments they are employed in. As a former support worker herself, Kennedy was able to see gaps in relevant and substantial care, leading to her unique programming. Extraordinary Workers has been in operation for 3 years, engaging the support worker community all over British Columbia, offering workshops, groups, and trainings in a variety of settings. Kennedy approaches the topic of resiliency by addressing how the entire workplace functions to mitigate the effects of trauma exposures on staff. Believing that when workers are properly supported to cope with their job demands, they can stay longer in their roles and build the relationships with clients that are so often necessary to healing and stabilization. Kennedy's message to support was simple. I see the valuable work you do. I see that you carry communities on your shoulders. You deserve support, solidarity, and access to information that can aid your ability to sustain your work and life.
Again, my specialty is in looking at treating, working with PTSD in particular. So in a lot of variety of settings, because we carry the same nervous system with us everywhere we go, my expertise is on what leads to traumatization of the nervous system and what mitigates those impacts, and also what heals the nervous system after there has been adverse experiences or distressing experiences. So yeah, that's basically the basis of what I do with individuals, with couples, with groups, with workplaces. It just kind of, bubbles out depending on the population, the context I'm working with. The only thing that I'm going to really go through is what leads to most people really struggling with self-care. And you may see my eye twitch a little bit when I even say the term like self-care. I struggle with it. Honestly, I go back and forth because it's so, I like at Sage, as you were saying, right? It's like, so self-care, and also Tracy in the programs and just everywhere on social media and everywhere. It's like self-care, self-care, self-care. The term has kind of lost a little bit of meaning for me. So, but I haven't come up with anything else to replace it yet. So any ideas would be fantastic if you have ideas on what to replace the term self-care with. But I'm going to talk about where most people have some pitfalls or where they struggle, where I see areas of tension across my clients and across my own experiences as well. And then I'm going to go through the physiology. Basically, what is the nervous system doing and how can we deeply care for ourselves on that level, right? A huge piece of this is going to be knowing what state your nervous system is in and choosing an appropriate, an effective sequence of strategies or skills or ideas to help the nervous system come down and deactivate and come closer to a state of safety. So we're going to talk about that because my guess, is that most of you, who knows a couple of breathing exercises? Who knows a couple of visualizations or meditations? Yeah. Who has a really good sense of if they're working or exactly when to use them for your nervous system? Yeah, maybe. Yeah, for sure. And this was one of my biggest things too when I was going through my master's, and you learn a ton of skills, and we talk skills, toolbox, this, that, of how do we have all these skills for taking care of ourselves. Skills are great, but they need to be applied. And if we work from the skill and we work backwards, or at least this is just how my brain works, so take this with a grain of salt, is I think to myself, okay, to get to the point of using a skill, what's before that? Well, I need to have that idea of why or what this is going to do, how this is going to help, because I got lots of skills, but there is often a gap in implementation and application or motivation. Has anyone been in that situation where you're thinking to yourself, wow, this could really help right now, and that's about as far as it goes, and it doesn't really make it into action? Anyone besides me? Yeah. Well, we're in good company then. Yeah, because it's hard. And if you don't have a philosophy and a theory and a working belief system on why these things are going to help, then we're just not going to do it. Or if we're not talking on a level that the nervous system and the body can understand. Thoughts are one thing. Thoughts, we can think a lot of stuff in a day. Sorry, I'm going to also have to refrain from swearing because I do that quite often. A couple might slip through, if that bothers anybody. Occupational hazard. I find if I don't swear that my clients don't trust me. Yeah, so we need to buy into why, and we need to talk to our bodies, not just have it go through our thoughts. So I'm going to go through the physiology and talk about the theory and the sort of belief behind it. And then what I was kind of hoping is that, we can talk strategies and you're going to get a booklet of them emailed out to you. But I want to hear from you what it is that you struggle with in your self-care and in that implementation of skills and theory into practice, and what we can do to kind of help each other out with that. All right. So where I see a lot of people struggle with their self-care, or to make it really sort of boil it down, kind of like self-care fails, or where that big gap is between knowing what to do and actually doing it, is one, this idea of a self-care plan gets too complicated. Okay. And the idea is, well, I have to journal, and then I have to take a bath, and then I have to have a meal, and then I have to do this, and then I have to do that. And holy smokes, that's like 5 hours in a day. And some of us don't have that to just kind of play around with in a day. So it gets too complicated, or we think that in order to take care of ourselves, the things that we have to do have to be really complex. I hear that quite frequently. The second one that kind of dovetails or fits really nicely into this is that it becomes way too much and it becomes something to just add on the end of a list. You know, on top of all these other things I have to do, then at the end of the day, well, I have to get into the bathtub. I have to, you know, I have to journal. I have to paint. I have to play music. And it just becomes all of these things that you have at the end of your list when you're exhausted and have no more energy left. And then the third one is that I see quite a bit is that people don't use the strategies that match or work with the state that their nervous system is in. And so I don't know if anyone else has tried this, but I have. Have you ever tried to meditate when you're really angry? No. How did it go? You're probably like, now I'm angry that I can't meditate because I'm angry and then I can't, yeah. Yeah, Tracy, don't even get to the cushion. Yeah. Uh-huh. For sure. Because that's not what your body's telling you to do. When you're angry and in fight mode, the last thing your body wants to do is sit down on a pillow. It's going, what are you doing? This isn't making sense to me. I'm dumping adrenaline and cortisol into your system for a reason. It's fine. We'll get to that. Okay. So does anybody have anything else that they feel like they see in themselves or they notice in their friends or in their coworkers and their folks where, this idea of self-care just doesn't work or there's a lot of tension or resistance or, like what do you see?
I think a big one for myself would just be initiating these practices way too late in the game. And so having a tendency to start thinking about the need for self-care or self-care practice after I'm burning out. And then kind of waiting for the next cycle to be like, okay, we just got to white knuckle through this. And maybe one day I'll learn the lesson. But yeah, that too little too late kind of thing.
Yeah, thank you for sharing that. I'm sure a lot of people can relate to the pushing through of the early body signals, right? I definitely can.
For me, it's also it's kind of related to that it's almost like I can't turn my brain off enough to get into that mode. And I realize that the turning my brain off part is probably what you're talking about choosing a strategy that's best for your nervous system at any given time. But I find that if my brain is really overactivated, that I might try something for a short period of time and then kind of just give up on it because there's no visible result. So then I just don't go back to those practices.
Yeah, great point. Does anyone else have a fast brain? Yeah. You know what? Some people don't, and that's totally fine. Some people do. Some people have racing thoughts, and some don't. There's no right or wrong way when it comes to our physiology. That can be tough when you feel like it's hard to focus on something, or when you work up the courage or you work up the moment to use the strategy and it doesn't work, and then it's just like, well, okay, we're just going to go back to what we were doing. I have also definitely been there. For sure. That is a tough one. Anyone else? What has either stopped you or you felt resistance to or you see in other people when it comes to self-care?
I find that busyness is more or less my avoidant tactic. So if my emotions are starting to build up, I'll get busier to avoid it. And then that is part of what my cycle is. Yeah.
Yeah, great, great insight. The avoidance, what I call avoidance distraction tactics, most of us are really, really good at them, and they serve a great purpose. They work wonderfully in the short term, but yeah, long term, the cracks start to come through. But yeah, that can definitely be one thing is if you start to implement self-care, there has to be a recognition that you need it. And sometimes it's hard to get there. Valerie.
I would be like,
Go ahead. Sorry.
Yeah, sorry, Valerie, and then Alice.
Good.
yeah, like maybe it's a question, or like that maybe it will be answered during this talk. And you know, when the Sadie was talking about like, oh, sometimes it's just like too late. But for me, like the question is like, also like, when do I do this? Is it like through my shift, or like when I'm in expedition for like 4 days with the kids outside, and it's like, so when is this supposed to happen? Or is there something that I should or I could do like during the trip, during the day, or is it something that kind of like build up during the day, and at the end of the day when I'm like taking my notes at like, you know, 11 p.m. and then I have something I can do then? Or it's like after the 5 days and I come back home and I'm like, oh my God, I have like in my head, and it's like giant clouds of like all the things that the kids have shared and like their lives and like
all
different things. And then it's like, oh, is it like at the end of the trip that I should do that, or can I have like some things that I can do like during the trip? And so yeah, so it's a bit also like about the timing that I'm like questioning, or
yes,
that maybe I don't do it at the right time actually.
Yeah, and that is such a fantastic point. And the answer to it is yes to all. You're going to be doing self-care during, maybe before, during, after, and again, there's going to be moments. So I do this with my support workers all the time, where we map out their shifts, because the one thing that I won't ask them to do, and I won't ask all of you to do either, is I'm not going to ask you to try to find more hours in a day to implement these things, because that's not fair. And that is one of the things that makes these self-care strategies so out of reach, is that, yeah, at 11 o'clock, you're doing your notes and you're like, all I want to do is just pass out at this point. I'm so exhausted. There are things to build in and work in without having to add more hours to the day. And we'll talk a little bit about that. I've made a note with my blue pencil here. I've made a note to sort of come to that. Wonderful. Thank you for sharing. And Alice, you wanted to jump in there.
Yeah, because I was just thinking, and maybe related to what you said earlier about like recognizing that we need to do some self-care. Sometimes just desire of getting out of the zone. Like I've seen it in friends, I've seen it in myself at some point in my life as well. It's just sometimes you don't want to take care of yourself, or people don't necessarily always want to have the space and the energy and the capacity to do that. That's also in there. Yes, wonderfully said. I agree. Sometimes there is really deep resistance. And sometimes that is the nervous system telling us, you know, well, maybe wherever you're at right now is the place you need to be. Maybe you do need to like really wallow. Maybe you need to let yourself feel whatever it is you're feeling without trying to change it for now. Right. And that's okay. That's acceptable too. Yeah. Again, if I had an easy, like silver bullet answer for all of you, I would give it. I'd also be out of a job, but you know, I would, I would give it to you. I would, but there is always, resistance, murky waters, as we've said. But you know, thank you for expanding again this conversation on where that resistance is. So we've got, you know, some of us will just push through. Definitely are signals that we need to slow down or do certain things to take care of ourselves. Sometimes we avoid. Sometimes maybe it's just not habit, and the nervous system is thinking, or the nervous system is sort of saying to itself, well, we know this pathway, we know this fast brain
anxiety sort of spiral. It's really familiar to us. We know exactly how much energy it takes to do something else, to risk doing something else, but there's an unknown outcome can sometimes really, we think to ourselves, no, I can't, right? So we'll go with what's familiar, even if we know that that's not the best thing for us in that moment, because we are creatures of habit and pattern. So in saying that, just to make sure that we have enough time for the, I'm sure, exuberant discussion that will follow, let's get into the physiology. And I am actually going to share my screen with all of you because I have a map, and this is based off of polyvagal theory. Is anyone familiar with polyvagal theory? Yes, a few. No, I see. No, Keith, that's fine. It's all good. If you want to learn more about it, you can always Google it. My thing would be not to read about it because it can get really dry. Watch people talking about it on YouTube. Because it's basically, polyvagal theory is just a theory about how the vagus nerve and how our nervous system in general reacts to the stimuli inside of our bodies, outside of our bodies, and what states it goes into to try to protect us, what happens when we need to feel protected, and then what happens to us when we feel safe. And it just explains that on a physiological level. And the person who came up with it is a medical doctor who does a lot of research and is not a counselor. So it's been translated into sort of counseling land by other therapists and things like that. So that's what this is based off of. So is everyone okay with me sharing my screen? And then Day is going to email these out to you so that you have them and can refer to them afterwards. Good. Okay. Let's do it. All right. And everybody can see that, I'm hoping. Thumbs up, thumbs up. Okay, fantastic. All right. So this is very colorful. I like to color code things. So here we are. It also makes it more interesting to look at, I think, personally. Yeah, so at the top there, it says witnessing violence, which I know is a little bit intense, but this is part of the workshops I do with support workers when we talk about what it's like to work in a work environment where you witness violence and violent acts and again, what's going on in the nervous system. So let's talk about the nervous system. I've already said that word probably more times than we could count, and I'm sure I'm going to sound like a broken record by the end of this. So bear with me. There we go, full screen. Okay. Yeah. So let's talk about this term nervous system. Okay. When I say nervous system, what I mean is the interconnected web of neurons that comes down through the spinal cord and, connects through motor neurons through to our limbs. And obviously sort of exits the brain here, goes down through the spinal cord. And what these neurons are doing constantly is they are taking in information about your internal and external environment and making changes to your physiology to help you survive. So if the temperature, for example, if the temperature in here was to raise 10 degrees, my body, without even me having to think about it, my body would respond to that by, I would sweat profusely, most likely, as most of us probably have this whole summer. And there would be other things that would start to shift and change. So our nervous system, again, constantly taking information, that's what it does. And when it comes to emotions, when it comes to our survival, our emotions are very closely based in that part of the brain and that part of the nervous system that just responds without us consciously thinking about it. If we could consciously feel certain emotions or choose just to feel certain emotions, like picking out an outfit, you'd say, okay, well, today, do I want to wear shame? Do I want to wear anger? Do I want to wear happiness? Do I want to wear, and we'd just be able to kind of choose. It doesn't really work that way we just feel, and it just comes straight from the information we're taking in through the nervous system, and we just feel. And there we are. And this is highly, highly related to our protection and our survival. So let's start at the bottom in explaining the different states of the nervous system and the responses that we have. Let's start at the bottom here because it's green, it's great, it's at the bottom of the page, and it's called the safe and social state. So when we are in the safe and social state, we feel calm because there are no internal or external threats. And we would like this typically to be our baseline where we spend most of our time. So if you look at the little boxes, and I'm going to read them out just in case you can't see it as well on your screen. In the little boxes is just the descriptors of what this state feels like. So in the safe and social state, we may feel grounded, content, compassionate, engaged, curious, open, joyful, understanding, confident, present, relaxed, flexible, responsive, social, hopeful, accomplished, connected, mindful, trusting. Okay. Sounds pretty good. Okay. I think there's a reason why we would like to spend most of our time here. Okay. In a perfect world, we would be able to spend all of our time here, but we do not live in a perfect world. We live in a world where we need to have a threat detection system. So if in our internal or external environment, we perceive that there is a threat of some kind, we will go into the threat state, which encompasses our fight and flight response. So this is when the part of the nervous system that gets activated is the one that is meant to mobilize us. Okay, depending on the type of threat. And we go into fight mode when we feel like we can be aggressive, authoritative, exhilarated, angry, irritable, frustrated. Sometimes we feel invincible even in fight mode. This is where we think this is going to be the best strategy to get rid of this threat, is to make ourselves bigger, is to act aggressively. And maybe that'll create distance between the threat and ourselves. In flight, we do the opposite. We get nervous and worried and anxious, and we want to hide. We might even panic or become avoidant. And that is when we say to ourselves, well, the best strategy here is to move away from the threat, and that'll create distance. Okay. In this state, the body dumps adrenaline and cortisol into the system. And I don't know if anyone's ever had this feeling. Have you ever felt like your brain and emotionally and everything else, like you're extremely tired, you're just exhausted, but your body is like wired and and your central nervous system is still moving? Anyone have that experience? Yeah. So that means that there's still that adrenaline and that cascade of neurotransmitters, and you're still in that threat state, still within that fight and flight response. So, the other thing that is important, as you see, there's a both section in the middle, is that this state, while protecting us, also allows us to perform. So when you are feeling like you need to be on. So I know Valerie was saying with the kids, right? When you are working with your kids, you need to be on, you need to be paying attention. I'm sure all of you do in your jobs, paying attention. When you're kind of blissed out down here in the green zone, you may not be paying quite as much attention to what's going on, or have to be on and expending that energy. Playing sports is another really great example. You may not be totally relaxed. You may have to have those bumps of adrenaline and that burst of energy to perform and to do that. So we can also perform here and harness this fight and flight and this big burst of energy to accomplish something. Okay. Depending on what's going on in the environment, what the stimulus is. Okay. Is this making sense so far before I move on to the danger states? All right, so let's say that whatever threat we were trying to fight or flight away from, let's say that that threat doesn't go away. And we end up realizing, the nervous system realizes that that threat isn't going to go away. We have this part of our nervous system that is our deepest protection and most intense protection. And it is called the danger state. And this is where we would freeze or go immobile. And the part of the nervous system that is activated here is the one that starts to shut us down because of significant overwhelm, either acute or accumulated. And our brains really start to slow down, our emotional range becomes diminished, and endorphins rush to numb physical and emotional pain. And basically, this is where our body is saying, okay, the threat isn't going away, it's getting too intense, so we're going to numb and we're going to separate ourselves out from the current moment. We're going to separate ourselves from our bodies. We become disconnected from our bodies. And this is where we may feel overwhelmed, limp, numb, frozen. This is often where depression lives, in this particular activation of the nervous system, where we feel helpless, trapped, hopeless. We may go into blackout rage if we enter this through the fight response, or intensely through the fight response. We may feel terrified, not just scared or afraid, but you're feeling terrified or horrified. This is where you may dissociate and go immobile or collapse. Okay. So something that I want to point out very, very clearly and without equivocation is that every single one of these states has a role to play in our survival. And we don't judge them, because especially sort of the threat and the danger states, it's really easy to not judge the safe and social state, right? But what I hear a lot is that people judge themselves for going into the threat state or going into the danger state. And it's your nervous system trying to do its best to protect you. That doesn't mean it's not distressing. These states can be deeply distressing. Okay. And what our bodies are meant to do is they're meant to go into the threat or the danger state and to activate and become activated, and then to come down. And what happens in chronic stress is we don't come down, back down to accessing the safe and social state. We get stuck in one of these protective states, and the body starts to feel those accumulated effects of stress, because the safe and social state is the only place where we refuel and repair and heal. Because these two states up here, the threat state and the danger state, we expend energy, and this is the one where we recoup energy. So the name of the game is, how can I, when I feel myself going into one of these states, how can I deactivate and start to come back down? Okay. It's a lot of information I just threw at you. So are there any major questions or things popping up for folks at this point?
I guess one thing I was just going to say is I appreciate like clarification that like high performance can happen in those aroused states. So it's like the athletic example I think is really big, but then also talking about things that can get in the way of initiating self-care. That high performance that can come on when you do have that anxiety and you are at the deadline or you're in a high stakes situation. To down regulate can be actually not what you need to kind of deal with the situation you're in. So I just appreciated that clarification. Thank you.
Yeah, for sure. yeah, we need to be able, our body needs to respond and release the amount of energy appropriate to meet the demands in our world as well, not just threats, but demands, right? The key is that when that deadline ends or when that thing stops or whatever is going on, then you allow yourself to that time to come back down, right? Because we're all going to have those cycles. We're all going to have those cycles. But what I find over and over again in my practice is that a lot of people, because we have this bias, we all know probably what stresses us out or what makes us feel like crap. Most of us have less attention and less focus on what helps us to feel comforted, what helps us to feel soothed, what helps us to deactivate and move through that. I don't know. Does that ring true to folks in the group?
Another question on like how you said that it's normal to go like on all those stages, obviously, and then come back, but like, is there any optimal like cycle of like, okay, at the end of the day you have to come back, or like each week you have to come back, or each month, or like I don't know if there is, probably not like a one answer thing, but is there something about this, like the frequency of like when you need to come back to the safe and social state?
Yes, wonderful question. Wonderful question. So there are going to be varying states of regulation that each nervous system is going to be in, and that depends on your history, on what pathway is familiar to your nervous system. So, for example, I have clients and have met people where they go straight from the safe and social state. They breeze through the fight and flight. They might not even feel this much, and they will pop themselves right in here when they start to feel threatened. And that's normal for them. Some people may, when they get stressed, just kind of hang out just above this line. They may feel like slightly stressed and then come back down. Every nervous system is going to be different. In well-regulated nervous systems, what I see the most is that most people will be pretty deep in this green zone for most of their time. They rise to meet the demands of their lives. So they, of course they feel anxious sometimes, they feel angry sometimes, they feel all the feelings. They let themselves come up and then they come down, and they do that multiple times a day. Up and down, up and down. I call it riding the wave. Riding the wave or meeting the demands. So for some people, that might be a little bit less frequent. We want to get it more frequent. Going and harnessing that energy and then accessing the safe and social state as much as possible. There's nothing inherently wrong with you if you don't, or if you find yourself kind of like hanging out in the middle of this zone, especially in the middle of a trip or something like that, because you're responsible for a huge group of kids. Like, I don't do that for a job, and there's a reason. That sounds intense to me.
Oh, that was what I was thinking actually, like when you're doing like group therapy and like as a worker, for sure you're thinking about like, oh, high performing and being hyper vigilant. Like I'm all like constantly looking at my group, looking like what is the group dynamics, and is there any crisis that is like coming up, or like how can I best use, like not even crisis, but like how can I best use like this what's happening to engage with like the learning for the teenagers. So that was exactly my question, like oh, so how is this, like how often is this supposed to be, or but that's okay, cool.
Or again, once you are not responsible for the group, that may be when you fully start to come down, like when you're done a trip and you got a couple days of solid sleep, you may start to find yourself coming down. It again, different circumstances, different contexts will mean that your nervous system goes through different things. So I hope that helps a little bit in a nutshell to sort of answer that.
Can I ask one question on that, Kennedy?
Sure.
Before we move on. So just if you're living in a situation where you're constantly, like it's more chronic and you're constantly in the threat or danger zone, like I would think that you have like a couple of choices to get yourself down into the green state. And that's either you like change your circumstances so that your
Mm-hmm.
circumstances are less
Mm-hmm.
triggering to your nervous system, or you like develop some tools that allow you to like go in and out of those states more smoothly and frequently. Is that sort of what you have just discovered in your work? Or
Yeah, there again, you're giving me a fantastic segue here to go into the next section, because this is exactly what we're going to talk about. Is now, what do I do with this information? Right? Knowing the states is great, but now what do I do with this information, and how do I apply it? Was anyone else wondering that, thinking that? Yeah. So, Caroline, if that's okay, I'm just gonna sort of segue and go into the next section. Okay. So there is going to be a particular sequence of events that needs to happen with our physiology in order to come back down to the safe and social state. And this screen that you're seeing right here is what we talked about around mapping out people's shifts, or mapping out the points in the day where they can utilize some of their interventions. But at the very top here, as you can probably see, we have some cues here around emotional regulation and healthy coping. So emotional regulation is the ability to feel and express emotions in a way that allows your needs to be met and to come back down to a baseline state. Okay, so we go into those states of high arousal and distress, and we come down. Healthy coping, anything that allows for emotional regulation, promotes connection, and does not cause harm to you or another person. Okay, so that's basically what we're talking about, is how to regulate the nervous system and how to cope in a way that works well for your particular nervous system. And we want to look at what our bodies are giving us in terms of its cues. So you have to ask yourself this question when we start talking about self-care. A, what state is my body in? That is the first thing. What state is my body in? Because the states ask us for different things. If you are in that threat state, in that fight or flight, remember, this is mobilizing. It's meant to be mobilizing. You may have to follow your body's cues to move, to shake, to cry, to run, to scream, to sing, to dance, to punch something, rip something, whatever. You may have to do that first and expend that energy and get the adrenaline to start dropping off before you use your meditations, your soothing and sort of grounding techniques. Because otherwise, if, like we said earlier, if you try to sit down on a pillow and try to meditate when you're high in your fight state, which is you're fighting a threat, whatever that threat may be, your nervous system is going to be like, what are you doing? This is not what I'm asking you to do. I'm asking you to mobilize. Why aren't you moving? And you won't be able to calm down. Your body won't let you. Right? To sort of calm in that moment. So if you are in that threat state, you need to move first. Okay? Does that make sense? So I'll give you actually, I'm going to wait for this. I'm going to explain the next part of this, and then I'm going to stop sharing my screen so that I can see all of you, because it drives me nuts when I can't see all of you. And then we'll sort of have more of a discussion around this. So that's the threat state. You need to expel that energy first and then soothe yourself. If you find yourself in that dissociative state, or if you find you're numbing out, shutting down, feeling that way, you need to use cues and reminders that you are safe in this moment, and you need to allow yourself to come back into and inhabit your body safely. Because remember, the point of this state was to start disconnecting you and numbing you and pulling you away from what's happening in the moment to just protect you. So we need to make the body a safe place to inhabit again. And then we can start to we'll start to deactivate and come down through the fight or flight state. So this is really key. This is not something that a lot of people expect. And I've worked with several clients through this response, is if you are somebody that finds yourself in that danger state, and that, again, totally okay. When you start to deactivate, you will come back through the fight and flight. So you may feel really panicked or really angry and upset first. That is actually a sign that your body is safe enough. It's letting you feel your feelings. Your body will not let you fully feel everything that you are feeling if it is not safe enough. If it is too overwhelmed, it will numb and dissociate and move away. Okay. So, for example, I had a client, this was ages ago in my internship, who was in that dangerous state a lot of the time, and they started to feel angry with me, and they started to yell at me, and they were so upset because they didn't want to feel it, or it was challenging to feel it. They were yelling at me, and I went, "Oh my God, you're yelling. I'm so excited. Like, you're mad at me. This is so great." And they were like, "What?" They were so shocked by that, but it is a sign that your body is starting to come down. So if you find yourself in that danger state, one of the best things that works is tactile stimuli. We are talking fuzzy socks. We're talking weighted blankets. We're talking anything that gives your body that signal that it's okay to start coming back. Conversation with a trusted person. There's lots and lots and lots of things. The other thing that works really well is gentle movement. So this also works well with avoidant tactics as well. If you find yourself avoiding things, is to start using gentle movement. So what I'll often do with my clients is we'll literally, if they start to feel frozen, we'll literally just sway back and forth in the chair. And start that, or I'll have them, tap their fingers or their toes. And we find areas of the body that are safe. Typically, nobody is against their right elbow, for example. So we're like, okay, can you inhabit your right elbow? Can we start movement back into the body very gently, very, very rhythmic. This is why, when you soothe a baby too, you pick them up and you're really rhythmic and gentle. We kind of want to do the same thing with us. Yeah. Any questions about this? Sort of asking yourself, what state is my body in? How can I follow my body's cues?
Can I pop in?
Yes, you may.
Yeah, what you were just talking about, kind of, you reminded. I'm sorry, I missed a bit with my baby just came down. But it reminded me a bit about Sarah Hager's guest speaker talk, which was last fall, and she was talking about relational, rhythmic, repetitive activities as ways to help modulate the part of the nervous system that responds to trauma. And so that just really reminded me when you were talking about that rocking, or the sensory parts of coming down as well.
Exactly. It is nice. It is soothing. Again, it reminds the body that it's an okay place to inhabit. And this is part of the reason why I also don't recommend heavy exercise. If somebody is really into that danger state and is dissociating, heavy exercise can actually worsen that. We want to start with those calming, soothing things first. So do you see how this can get tricky when we're talking about self-care strategies, right? When to implement them, how to implement them. It's not quite as easy as just or it can be quite simple, but its implementation is sort of important when we're talking about what state am I in? What state am I in? What's going to work for me? Are there any other sort of questions on this, ideas? Disagreements, I'm also open to those if anyone has them. No, is this making sense? Do I need to clarify any part of this? No. Okay. Most people are shaking their heads now. Okay. So let's talk about this little map here. Strategies to move towards safety. So again, in the booklet that you're going to get, there are strategies out the wazoo. There's breathing techniques, there's visualizations, there's some ideas that are specifically come from the mind of Kennedy, which is when I come out of a day, I'm in fight mode. I'm pretty activated. So it's just from sitting and listening and doing my job and sometimes other life things. I love music. One of my favorite things to do is to blast some Pantera in my headphones and it's to stomp around my neighborhood until I feel better. That works for me. That playlist of mine is about 30 minutes. It starts with Pantera and it ends with like Cat Stevens, and that helps my nervous system to start regulating again. And that's what I like to do. I like to use the music and the drum beats and the energy of each song. Each one starts to take me down. That's a strategy I started to use, and it worked really well for me. There are a million other ones, but the idea is that anytime in your day where you get a break, or anytime in your day when you are feeling like you need a moment to slow down, or there are so many different things that you can do, and it's really important that we do this multiple times a day, especially if you are in a high stress situation. And the idea is to ask yourself, what is my body perceiving throughout the day? Am I getting more signals of threat or more signals of safety? When we get signals of safety, our bodies naturally calm and relax and allow us to connect and come into that safe and social state. So we want to think, what am I doing? What am I feeding my body? What am I feeding my brain? What am I feeding my senses? When I wake up in the morning, for example, am I listening to, am I immediately flicking through the news? Is that activating me right from the second I wake up? Or am I, watching, cats and dogs becoming unlikely friends? Or are you just sitting in the sun with a coffee? Like what are you doing? What are you feeding your brain the minute you wake up? What are you doing on your commute to work? I had a client who was listening to true crime podcasts on their way to work. And I said, considering you're going to work in an injection site, maybe, let's look at that. And they were like, I like the true crime, but it is intense. And I'm like, okay, maybe let's put some comedy in there. It's something to make you laugh or change that a little bit. What are you doing when you have 5 minutes in your shift? 15 minutes when you have an hour? What are you doing on your commute home? You're already commuting home. What are you doing with that time? Are you physically exerting yourself to get rid of that energy at the end of the day? Are you putting on a really comforting playlist, or are you talking to your mom while you're coming home because you just need that comfort? What are you doing? What are you doing as you're getting ready for bed, as you have days off? What, again, this question I keep coming back to, what signals is your nervous system getting throughout your day, throughout your life? And how can we skew it to have more signals of safety than signals of threat? So this is just, you can use this if you want to. This is just outlined as sort of a basic idea of where those intervention points might be. So I'm going to stop sharing my screen for now so that I can come back and see all of you. Hello. Hello. So anything coming up at this point? Questions, thoughts, musings? Tracy?
I had a musing. It's kind of out in left field maybe, but
Sure, go for it.
I'm thinking of people who have autism and stimming. And I was connecting that to what you were saying about, using self-touch to ground yourself. And I'm wondering if that's a similar phenomenon that's going on.
Yeah, I am not an expert in working with those particular nervous systems, but to take a shot at it, yes, I would say it is, again, it's a way to either offset energy or come back into the body or regulate in some fashion. Yeah.
Thank you.
No problem. It's my hot take. Yeah. So maybe what we can do is from this point of view of here's my nervous system, here's are the different states it goes into. Maybe we can talk a little bit specifically more about your routines and what it is that you do. So let's start with that fight and flight. Knowing that the way to deactivate and come out of that is movement first and then sort of soothing. What is it that all of you do? Because my guess is you already do a lot of the things that we're talking about. You just may not recognize it. What is it that all of you do when you recognize that you are in that fight and flight state to try to offset that energy and help yourself feel better? If you feel comfortable sharing.
Hey, Keith here.
Hi, Keith.
I do, I've been through did a bunch of EMDR stuff. So I do a lot of breathing to calm myself down, bring down like the blood going to the brain to bring all my thoughts back down. So I'm just curious. So once I'm in that danger mode and the heart's pumping, I got to get rid of that energy. But now I'm getting more blood going to the brain. I'm like, how am I going to calm down from that? If I'm in the danger zone, but perceivably nothing is going on that's dangerous, you know what I mean?
Yes. So danger zone is where you're shutting down, where you're numbing, dissociating. The threat state is when you're in that fight or flight. Are you talking about when you're in that fight or flight, you're starting and you're feeling really activated, you use breathing exercises to start to bring yourself back online?
Yeah, yes.
Okay. So how long do you do your breathing exercises for?
About 5 minutes.
Okay. And what do you find happens after that 5 minutes?
I calm down.
Okay. Do you find that that's enough?
Most of the time, but I practice it 5 minutes in the morning, 5 minutes at night, and when I'm feeling good.
Yes. Excellent point. Breathing strategies, I mean, any of these strategies, but breathing strategies especially are really, really great to practice when you're feeling good. And it may be enough to bring you down when you are feeling really stressed or activated. It may be enough to bring you down. You may have to do them for longer. And then you might have to pair it after that with, depending on how activated you are, pair it with another strategy right after that. So you could use a breathing exercise to start to calm you down. If that doesn't work, or if that doesn't bring you down enough, then you can see if a walk will help. And then if that doesn't work, then you see if a visualization will help. So sometimes the more activated we are, the more strategies we need to do and in sequence with one another for longer. Does that answer your question, or did I miss the boat? Are we in the water somewhere?
I think it did. Yes.
Okay.
Yes.
Okay. Alice, yeah.
Yeah, sorry, I had a question.
Sure.
So are you saying that when we use breathing techniques, when we feel good, so when we are in the green state, later on when we use them, when we're activated, then we would have an easier time calming down? Interesting.
Yes.
Is that because conditioning, or we're just kind of associated with when we're feeling good and calm?
Yes to all. Yes, it's all of that. And breathing exercises work great for some people. For other people, it'll actually activate them more. But they need to be practiced. And the reason they need to be practiced is because the muscles and everything, learning how to breathe through the diaphragm as opposed to upper chest, sometimes we need to condition those muscles to be able to let the breath down and get used to that and get familiar with that. Because when we're stressed, we typically won't reach for things that aren't familiar to us. So if we can increase our familiarity with the strategies that we have, then they'll be easier to reach for, and you'll start breathing in a certain way and the body will be like, oh, hey, yeah, I know this. This works. Great. You know? So I hope that helps to answer that. Okay, fantastic. So what about for other people? What gets used? What do they use? What works?
I know in certain situations, like more interpersonal situations where I get into like a threat mode,
Mm-hmm.
I tend to like want to talk it out, argue, which I'm not actually sure after listening to this is the best strategy. I think maybe like trying to get into my body more to start with to try and release some of the energy could be better, but that's what I tend to like go through, is trying to solve the threat issue right away by trying to like talk somebody else into like something where I feel comfortable.
Okay. Yeah, thanks for sharing that. And sometimes that might be the thing that works. Sometimes it won't be, depending on the situation, right? This is all very situation and context dependent. It sounds like if we're going into talking or arguing in particular, sounds like we're going the route of a little bit more in that fight mode, which again, I'm right there with you. That's where my nervous system goes from years and years and years of playing sports. So there's a couple things you can do. Anger is a completely valid emotion. All our emotions are valid, but I hear anger dismissed the most. Anger in fight mode, totally acceptable. Okay. We're allowed to feel that. It's okay. The choices that we make on how we express is where sometimes we'll get ourselves into trouble. So other people, and I'm not saying that you necessarily do this, Carolyn, but I'm just for the greater good right now. Other people are not avenues for our anger. We need to dispel that energy first, especially if it's too high, for an interpersonal situation, and then come back to the conversation. So I'm a huge proponent of physical expressions of anger. If you need to go into the woods and beat up a tree, or maybe not beat up a tree, but like throw something so it doesn't hurt anyone. If you need to throw rocks into the ocean, one of the best things I've ever heard is somebody took a metal bat and hit rocks into the ocean. That sounds like a great idea. If you need to rip up a piece of fabric, if you need to break a dish in a safe sort of spot, if you need to punch something, scream, then you need to do it. Those things on your own are not going to hurt anyone. Somebody, if you're screaming in your car, someone might be like, whoa, that person's a bit, but whatever. You need to express that first. And then once the energy comes down, then you can kind of come back to conversations. So you may need to practice some of those things, and release, come down, then talk. So I hope that helps a little bit. Okay. And sorry, Valerie, before you jump in there, Sage, I saw that you had unmuted at some point. Were you wanting to jump in there as well?
Yeah, well, I was just gonna say, like, one positive one is somebody who has like generalized anxiety and panic disorder. It's something that I found is just to go for the walk. And it's really interesting as well, from growing up on the farm and living in a cabin for half my life. And then also, so when arousal hits there, it's like, oh, bear, oh, animal, what's going on? And then I respond accordingly. But when I'm also at a deadline with an assignment and panicking about how I'm not going to do it and I should have done it sooner, I get into the same arousal state. But when I sit at my computer and try and type it out, it just gets worse.
Yeah.
And so quite by accident, I just noticed like the getting out and moving and going for a walk actually allowed my body to send signals of like, okay, we're doing something about it. We're getting away from whatever that threat was.
Yeah. Yes, because sitting and holding. So I would imagine, And I was a grad student too at some point. So I'm sure we can all relate to this feeling when you're trying to sit on your computer and you're just like, you're holding all this tension. And you're just, or you feel like you're going to jump out of your skin. Yes, you need to move. Go for a walk, go for a run, go whatever, move in whatever way is going to help you. Even if you just need to pace around the room or sway or do yoga or whatever, jump rope, blah, blah, blah. There's so many options. Yes, that will dispel the energy. You're following your body's cues. So your body and your nervous system talking directly to your nervous system going, okay, all right, fine. I hear you. I'm doing what you're asking of me. Now you're going to start to deactivate and come down so that I can focus. Because yeah, the frontal cortex starts to go offline when we get stressed like that, right? So you brought your frontal cortex back online and you felt that difference. It's a great example. Yeah. And Valerie, I know you had a hand up there.
Yeah. Well, it's kind of like in the same line that I had like one event, but that was actually like directed to me in news that was kind of a bad news, shocking, like angry news. And I just like, okay, like put back the phone. I went into the other office that was empty and I did like push-ups. So I was to just like get it out and then like come back and then talk to my coworkers and like figure out something after like the push-up did like calm me down from this like one punch. But then my other question, like leading from this, I think, well, for me, I feel it's easier to come back when I like in an acute, if I have like an acute stress or something that is like more clear, like something's happening and I'm like, oh, I go do push-ups and then oh, calm down and then do something. And I feel it's way more difficult when it's like a build-up, like a slower build-up of like accumulating like little stress, little piece of conversations that were like, ooh, like getting heavier, like slowly heavier from the word, from like multiple stories that I've heard and like multiple days coming in, or like so that's it's just like piece of stuff of like, okay, maybe like I don't know, I'm probably gonna go back at the map and see like how be more aware like where I'm at when it's like slowly rising up.
Again, sometimes it's really easy, as Sage was saying as well, when there's a bear, it's very easy to be like, oh, bear, threat, hey. It's that's a really easy thing to see and to wrap your head around. When it's chronic accumulated stress like you're talking about, or just those situations where it just is sticking to you and you're just feeling the tension build. So we need to actively find a moment, a time in the day to release that energy. So and this also goes to one of your earlier comments, Valerie, as well. Where I start with most of my support workers and most of my folks, or if they're single parents or parents and they're running around crazy schedules, is the one place where I want you to see if you could start applying some of these strategies is between your commute, like on your commute home, basically between when you end work and when you're shifting into your personal life. Where most people get burnt out is when they carry this work energy or this stress energy into realms of their lives when they are hoping and wanting to rest. Because shockingly, you carry the same nervous system with you everywhere. So, it's not going to just magically be like, oh, I'm home now. Let's feel relaxed. It may not be that easy. If it is, awesome, but it might not be. So see if you can apply a couple of these strategies, mainly the physical movement and then the soothing between work and home. That walk I was telling you about, where I put heavy metal in my ears and I walk, that is, I park my car and I do that before I actually enter my personal space. So I'm not carrying that energy into my personal space. I know that stress is accumulated over the day. I give myself permission that one time, at least a day, to release, because there's no downside to it. You release more energy, great. you're coming back to that green state, you're going deeper into that green state. To me, there's no downside to it. So yeah, with that chronic buildup, you want to actively say, okay, I need a point to release this once a day, maybe more. That would be if I had to give you a sort of specific number, it would be once a day. I hope that helps. Yeah.
I just wanted to throw in really quickly too, something that came up is just that sometimes these aren't adaptive as well. I'm a cigarette smoker. And so it's like, that is functional for me. And sometimes that is the only time I get a breath. And so I heard somebody express that when a cigarette smoker is quitting smoking, they're also quitting meditating however many cigarettes they were having in a day, right? And so I think it's important to be mindful of things that are sometimes deemed unhealthy can be functional, just like these responses are. Sorry.
Yes. Yeah. Exactly. And there's the ritual of taking out the cigarette, lighting. There's a whole ritual that goes with it that often gives you a chance to, for sure. Alice, I know that you wanted to jump in there.
Yeah, well, it was kind of like in the same area because I'm a smoker as well, and it kind of always pops up. But I was just like kind of wondering as well with some of the like strategies that you mentioned for like anger when you're like in the threat state and that sort of thing. Like, how does it? And like Sage, you mentioned like how is adaptive like for you, but I was just wondering like how to manage when that becomes like not adaptive, because I feel like you can just kind of get into that cycle. Well, yes, for sure, like going outside for a smoke will help me, but if in 10 years from now, I'm gonna have a very bad time, right? So, but also just like, getting into the woods and yelling or like punching something, like that can become like very fast, not very healthy. So how do we manage that? And also it can kind of become like an avoidance strategy instead of just like a calming down technique or something like that. How do we navigate those like very thin, fine lines and nuances?
Yes, that is again a great question. And again, each nervous system is going to be different. So what's going to work well for one person can become, like you saying, detrimental or become for some people who have sort of obsessive tendencies. There's certain strategies we use, there's certain strategies we don't. What I would say, and the most sort of overarching answer I can give to you without sort of going into more individual sort of counseling type things would be, I always recommend having a lot of different strategies at your disposal. And if one starts to not work, then you try another one, right? You want to have a wide variety of strategies for a wide variety of circumstances. And I would add strategies first before you start taking any away. Because when we start taking things away and we feel deprived, or we feel like we're not as protected, or we feel like we don't have our familiar things, the nervous system responds with a threat response and gets very cranky. So we add first, and we try different things, and we expand ourselves and our tolerances and our capacities. And then if we want to start taking away or changing things, then we do that from there. So that's, I think, with the amount of time and the content, I feel like that's about the best answer I can give to that without going into, I mean, I can talk about this for days, and I do, but it's not for now, as I see it's 7:02. So we should probably start to wrap down here.
That's awesome, Kennedy. We have, that's not anywhere near the first time we've gotten questions about smoking as a lizard brain intervention on the course. And particularly seems to come up with tree planters, although not exclusively. I won't stereotype too much, but it's really wonderful the way that you frame that in terms of, supporting our nervous system, not just to go into more of a threat response, because now we're taking away like the one thing that it was kind of using to cope. Thank you for that.
I just wanted to say I really appreciated how, Kennedy, how you showed how the body's vagal response can flow. And I really look forward to getting that booklet, because I'll be posting that on my wall and trying to use that process intentionally. So thank you very much.
Yeah, that's incredible. Thank you. Thank you for sharing that. Yeah, this, as much as I can say, you know, I've worked with a lot of clients. Using this approach in my practice has helped me as a human being so much. So a lot of the strategies I talk about, I've either used or myself, and continue to use and rely on to care for my own nervous system. So yeah, glad I could help. Yeah. Hi,
I
Tracy.
had another question.
Sure.
You said that that flow chart and those 3 states were based on the work of someone. I
Mhm.
didn't catch the name. Could I
Yeah,
have it so I can maybe go and look it up, like you said?
of course. I'm going to drop it in the chat box here. It's called polyvagal theory. And the person who came up with it, his name is Stephen Porges. I'm just making sure my typing's accurate. There you go.
Sweet.
Yeah, there's a lot of really fantastic material out there. The person that I would recommend looking up, who explains things very well and has some great books out there, is an author named Deb Dana. I just dropped that in the chat box as well. If anyone's read books, also like The Body Keeps the Score, that's a really popular one. Has anyone heard of that one? Yeah, the Body Keeps the Score is another one that's sort of based on, again, the physiology of how the nervous system protects itself. I will drop that in the chat box as well. Also, it's just a really catchy title. Every time I hear it, I'm like, man, that was a good choice. It was a catchy title. Yeah. Yeah. Oh, any other sort of, I see you all are sort of hanging around. What other topics? What other questions? What's going on in everyone's brains, bodies
Sometimes
today?
folks just hang out so they can like listen for any other really interesting questions that get asked.
Well, you're smart. I mean, for sure. You've already invested the time. You might, yeah. And this is a great group as well. All of you have been amazing.
I just wanted to say I really appreciated that recommendation to like more self-care strategies before less self-care strategies. I was working as an addiction support worker, and it's so often that like addiction is functional, right? And so it's like reminding people, and but also noticing, even with my, for example, my smoking, it went up when I was in the process of burning out, and I quit going for walks, and I quit my breathing practice, and so it was like one of these things where somebody was like, hey, you haven't been to this yoga class or whatever in a long time. What have you been doing? And then in my head, I was like, oh, just chain smoking. Like, oh no. And so it's, I really appreciate that, because I think it can be, we can put a pressure on ourselves to like remove self-care strategies that are deemed to be harmful, or are harmful in my case as well, without thinking of like, okay, what's gonna bear the load that this is gonna leave, right?
Exactly. The analogy I use a lot is, you know, if you have a small child with a security blanket, you can take away the security blanket and watch the temper tantrum and just absolute fear that ensues and distress, or you can offer them something else and see like what they do. Is it, you know, you offer them and see if they'll take it. Yeah, it's absolutely, like, that makes so much sense. And what needs to stabilize in order to accommodate the change we're making, because our nervous systems don't like change. So if we're gonna move a pillar of our existence, the other things need to compensate and need to stabilize and hold what's going on. What I see a lot of people do is they make a lot of changes really quickly, and they wonder why they feel really unstable, and the body again reaches out for the familiar things, and bears down on them actually harder. So yeah, again, same thing that you're talking about, and great examples, great self-insight. And like we all get off track every once in a while. It happens. I don't even think it's off track. I think it's just part of the track. So
windy road. Like for me, like
exactly.
after this evening, well, it's evening for me for sure. It's mostly like the question, so what is your routine? Something you said, I was like, oh shit. Yeah, like what is my routine? So like what is familiar and like yeah, what is my routine to it, and what do I practice when I'm well, so I can like come back to it more easily if it starts to build up. And yeah, what is the routine? That's a good one.
Yeah, that's a good question. It's yeah, something a lot of us are always striving to build. Sometimes we have great routines, sometimes not so much. Hi, Alice. Yeah, no, that was a big revelation for me as well, sort of practicing things when you're already feeling safe. It makes so much sense. Like you wouldn't, oh yeah, I should have said this in the talk. I forgot. A colleague of mine used to use the analogy, you don't jump into a boxing ring just in like a heavyweight fight without any practice and be like, okay, here I am. Chances are you're going to get hurt or it's just not going to be a pleasant experience. So like, yeah, you gotta practice so that your body gets used to it and becomes familiar with the strategies. That blew my mind. I was like, why didn't somebody teach me this in elementary school? That would have been really helpful. Like way before my master's. Master's is too late. Yeah.
Well, thank you so much. It was lovely.
You're very welcome.
I can't wait to have the booklet and like look at this sheet too, like the map, the routine, right? So
Yep. It's coming to you.
Yeah, thank you so much.
Thank you for your contributions.
Yeah, it will take me some time to process the recording, especially because I'm heading up to Inuvik this week to deliver a course up there, but it will happen and I'll send out the recording as well.
Awesome. Looking forward to it. Thanks so much, everyone.
Yeah. Thanks,
Bye.
Sage.
Thanks,
Yeah,
Sage.
thanks for your
Thanks, Amy.
contributions.
Valerie.